Okay, now we're going to talk about the head, face, neck, including the regional lymphatics. You're going to inspect and palpate the skull first of all. The skull should be round, it should be symmetrical and appropriate related to the body size. It should feel symmetric and smooth. The cranial bones with normal protrusions are the forehead, the lateral edge of the parietal bone, the occipital bone, and the mastoid process behind each ear. There should be no pain or tenderness upon palpation. Any lumps, depressions, or protrusions are abnormal. You should palpate the temporal artery above the zygomatic bone between the eye and the top of the ear. You should palpate the temporomandibular joint and ask the person to open and close their mouth. It should be a smooth movement with no limitations or tenderness. There should not be any popping or cracking when they open and close their mouth, and they should not have any pain. You're going to inspect the face, noting facial expression and that it's appropriate to the behavior and the mood, noting any anxiety as well, or any hostility or aggression. You're going to note the symmetry of the eyebrows, the nasolabial folds, and the sides of the mouth. You're going to note any abnormalities in facial structure, like coarse facial features, exophthalmos, any changes in color or pigmentation, and any swelling. Periorbital edema and edema of the cheeks is not normal. You need to note any grinding of the jaws, any tics or excessive blinking also. You're going to inspect the neck for symmetry. The head should be midline, and the neck muscles should be symmetrical as well. You're going to do range of motion. You're going to ask them to touch their chin to their chest, put their head back, turn to the left, turn to the right, and then touch ear to shoulder. It should be a smooth motion. It should be well controlled. There should not be any limitation of motion, and there should not be any pain with that as well. You're going to examine the lymph nodes, and the lymph nodes that you will need to know are preauricular, postauricular, occipital, retropharyngeal, submandibular, submental, supraclavicular, deep cervical chain, and light cervical chain. You're going to start using the gentle circular motion with the pads of your fingers and begin at the preauricular in front of the ear and palpate all of the lymph nodes. And you're going to be systematic and thorough. You're going to use gentle pressure. Strong pressure pushes the nodes into the neck muscles, and it's most efficient to do both sides at the same time, so you can compare the two sides for symmetry. Lymph nodes should not be palpable. If they are palpable, you're going to note the location, the size, the shape, the delimitations, mobility, consistency, and tenderness. Cervical nodes sometimes are palpable in healthy people, and all that palpability decreases with age. If they are enlarged or tender, you might want to check for drainage of the source of the problem. Proximal, which is upstream to the location of the node. A single enlarged non-tender hard left supraclavicular node may indicate a neoplasm in the thorax or the abdomen. Painless, rubbery, discrete nodes that appear gradually are common with Hodgkin's lymphoma. Cancerous nodes tend to be hard, enlarged, unilateral, non-tender, and fixed. You're going to look at the thyroid gland to look for symmetry as well. You're going to ask the person to take a drink of water, and you're going to watch the thyroid gland as it moves. You're going to use your hands to palpate, and you're going to feel that thyroid gland go up and down when they swallow. You're going to use the left hand to displace the thyroid and palpate with the right hand. And do the opposite with the other side. In infants and children, head size is measured with each visit up until the age of 2. You're going to palpate the skull and fontanelles while the infant is calm and in a somewhat sitting position, because crying or lying down or vomiting may cause the anterior fontanelle to look like it's bulging. The skull should feel smooth and fused except at the fontanelles. The fontanelles are firm, slightly concave, and well defined. You may see a slight arterial pulsation. The posterior fontanelle may not be palpable at birth. If it is, it's extremely small, 1 centimeter, and closes by age 1 to 2 months. The anterior fontanelle is small at birth and enlarges as the child gets older. Um, it closes at about 9 months to 2 years. Early closure may be insignificant and the head growth proceeds normally. During infancy, cervical lymph nodes are not normally palpable, but a child's are. They tend to be less than 3 millimeters for normal. Children have a higher incidence of infection, so you expect a greater incidence of inflammatory adenopathy, but there should be no other masses in the neck. In pregnant women, the thyroid gland may be palpable as a result of hyperplasia of the tissue and increased vascularity. In the aging adult, a mild rhythmic tremor of the head is normal. It's usually benign, and so is some head nodding and some tongue protrusion. Some of the teeth may be lost, so the lower face looks a little bit smaller with the mouth sucking in. The neck may also show an increased cervical concave curve with the head and jaw extended to compensate for kyphosis. Range of motion for the older person may be difficult, may experience dizziness with the side movements as well. And that is it for head, face, neck, and regional lymphatics.